I wanted to come and personally thank the outstanding team at Ottawa Civic Hospital, led by the outstanding President and CEO, Cameron Love, as well as all of our frontline workers at our Ottawa hospitals and long-term care homes. You're absolute champions. You've been true heroes over the past few months. And Mayor Watson, it's great to see you again, and thank you for our many great discussions we've had. We've been listening to you and to the people of Ottawa, and I'm here today with our Minister of Finance, Rod Phillips, our Health Minister, Christine Elliott, and all of our local champions, Minister Lisa MacLeod, Minister Marilee Fullerton, MPP Goldie Gamari, and MPP Jeremy Roberts. I always say Ottawa is well represented because we've made incredible progress here in Ottawa. A few weeks ago, when we first saw the second wave that hit Ottawa, we worked closely with Mayor Watson, Dr. Etches, and our team to quickly bring in targeted action to stop the spread of COVID-19. And thanks to that early and necessary action, we're now seeing real improvements. And I was talking to the mayor the other day, and it's amazing when people band together what they can do. New cases in Ottawa are trending down. People are following the rules. And I agree with Mayor Watson and Dr. Etches 100% when they say we have to find ways to make sure we keep our schools and businesses open while protecting everyone's health and safety. That's why, effective tomorrow, I can confirm that Ottawa will be moving to the orange restrict level of our new COVID-19 response framework. This means Ottawa restaurants, bars, and gyms will be able to reopen tomorrow, provided they follow public health measures. York Region will be joining Ottawa as Eastern Ontario Health Unit moves to yellow protect level. That's because of improving public health trends. After consulting with local medical officer of health, our chief medical officer of health, and in line with the clear indicators outlined in our new COVID-19 framework, Peel Region Health Unit will move to the red control level. This is why we have the framework, so we can scale up public health measures to protect the health and the well-being of the public. We need to get this virus under control in Peel. The region is averaging 103 cases per 100,000. The percent positivity in daily cases is growing. Hospital capacity is under pressure as we bring in reinforcements to support case and contact management. As we move many more regions across the province into this new framework on Saturday, I am confident our government has a clear plan to support frontline healthcare going forward. That's why our government is delivering $15.2 billion more this year for healthcare through the 2020 Ontario budget. Ontario's action plan, Protect, Support and Recover. That's an additional $15.2 billion to reinforce our healthcare system and better support our frontline heroes and the patients they care for. Mr. Phillips has done an incredible job to make every resource available to fight the deadly threat we face with COVID-19. Thanks to this plan, we are ready for anything. We have the most comprehensive and robust fall preparedness plan in the entire country. This investment will help us clear the backlog of surgeries and improve access to care at hospitals across the province. As we announced yesterday, the next phase of Ontario's action plan will add over 2,200 hospital beds right across the province. That's over 2,200 additional beds to ensure we have the necessary capacity to care for patients and battle any future surges or waves. We're making an investment of over $350 million to help bring the necessary capacity to our hospitals. For Ottawa, this funding means 254 more beds for the region, and that's huge, 254 more beds. My friends, help is here. We're continuing to build our surge capacity, but we hope never to have to use it. I ask the people of Ottawa and everyone across the province, please continue to follow public health measures, watch your local alert level, be responsible when you dine out or go to the gym, and avoid large gatherings. Together, we can protect our hospitals and get back a little more of our normal lives. Thank you, and God bless the people of Ontario. Now I'll pass it over to Minister Phillips.
It's a great honor to be here in Ottawa with my colleagues. Thank you, Premier Ford, for your leadership, Minister Elliott, for your leadership in the health area, of course, Minister Fullerton and Minister MacLeod, great colleagues around the cabinet table, and our MPPs, Gamari and Roberts. Thank you. And thank you to Cameron Love, the President and CEO of Ottawa Hospital, for welcoming us here, as well as, of course, Mayor Watson. I was teaching Mayor Watson, we call it the shuffle when we sit in these groups behind us as we move around today. So we'll see how well he does during the press conference. Yesterday, I announced the next phase of our government's response to COVID-19, Ontario's action plan, Protect, Support and Recover. Our plan has three pillars. First, we are taking steps to protect people from the deadly virus by increasing our investments in healthcare to $15.2 billion. Second, we are building on the early relief provided for a total of $13.5 billion in direct support for families, workers, and employees, and that's in addition to $11.3 billion in cash flow support. And third, we are removing barriers to recovery and providing $4.8 billion to protect and create jobs now and in the future. This next phase of Ontario's action plan brings the total COVID-19 response by the Government of Ontario to $45 billion over the next 3 years. Protect is the first pillar of our plan, and today's $45 million investment in those 254 beds the Premier mentioned in Ottawa is just one example of how we are doing what it takes to continue to protect people from COVID-19. The people of Ontario have done and are doing their part, including here in Ottawa, by respecting and following public health advice. And our government is doing ours. In total, we're spending $8.3 billion more to protect our frontline healthcare heroes and protect people from COVID-19. This does include supporting 141 hospitals and healthcare facilities, 626 long-term care homes since the pandemic began. As we announced yesterday, this includes an additional $572 million more to ensure Ontario's hospitals have the necessary resources to continue providing care for those who need it. And that means in total, our hospitals receive $2.5 billion more than they received last year. Since March, working with our hospital partners, we've added an additional 3,100 beds to help communities be prepared for scenarios. That includes, of course, the 2,200 the Premier mentioned most recently added. Ontario has built the most robust testing network in the country, which includes 161 assessment centres, 170 pharmacy locations, and 40 community-based mobile testing units. We're leading the country with testing of over 5.3 million tests since March. And we purchased $1.1 billion in personal protective equipment to protect our frontline heroes so they can do their jobs safely. That's 300 million masks, 900 million gloves, 50 million gowns, and 6 million face shields. Ontario's action plan, Protect, Support and Recover, makes good on Premier Ford's simple and non-negotiable promise to the people of Ontario at the beginning of this pandemic. Your government will do whatever it takes to get through the pandemic. As COVID-19 continues to threaten our health, we will continue to be there to protect the people of Ontario. And with that, I'll pass it over to the Minister of Health and Deputy Premier, Minister Elliott.
Thank you, Minister Phillips. I want to start by thanking the staff and leadership at the Ottawa Hospital for your incredible and ongoing efforts in response to COVID-19. Our doctors, nurses, and healthcare workers really showed us their determination, compassion, and commitment to protecting and keeping us safe. Thank you to all the staff, physicians, nurses, and volunteers for all of your efforts. Our government will do whatever it takes to protect the health and well-being of Ontarians and ensure they have timely access to the care they need close to home. That's why we are investing nearly $45 million to create up to 254 more hospital beds in Ottawa. This includes 39 beds and 20 ambulatory offload spaces at the Ottawa Hospital, 120 beds at the Greystone Village Retirement Home, 56 beds operated by the Queensway Carleton Hospital, 10 beds at Hôpital Montfort, and 9 beds at CHEO. Today's funding also includes over $16 million to build the new Emergency Department Ambulance Offload and Medicine Transition Unit facility here at the Ottawa Hospital Civic Campus, and $1.5 million to hire dedicated offload nurses at 4 Ottawa area hospitals to support paramedics transferring the care of their patients to hospital staff, allowing them to respond to the next 911 call more quickly. Through these investments, our government is increasing hospital capacity and reducing wait times for patients and families in the Ottawa region, and ensuring our health system is able to respond to COVID-19 outbreaks and help patients waiting for surgeries and other procedures. So thank you, and I would now like to invite my colleague, Minister Fullerton, to say a few words.
Thank you, Minister Elliott, and many congratulations to Minister Phillips on delivering the budget yesterday. Our action plan keeps people safe, supports our businesses, and lays the way forward for us. And I'm so pleased to be here today with the Premier and my MPP colleagues for this announcement that is so critical for Ottawa and surrounding areas. As the Minister of Long-Term Care and as local MPP, I know that the opening of these new beds at our hospitals is critical to a healthy community. And I want to thank our hospitals, whether it's the Ottawa Hospital, the Queensway Carleton Hospital, CHEO, or the Mulfort. I want to particularly thank the Ottawa Hospital right now who are helping with our home in Nepean right now. So I thank you very much. And special thanks to Cameron Love for all his help and his team. These are true champions, and they are regional champions. These partnerships are what will ensure that we have a truly integrated healthcare system, both here in Ottawa and across the province. And I would now like to call upon my Ottawa colleague, Minister Lisa MacLeod.
First, I'd like to start off by thanking Premier Ford, Minister Phillips, and Minister Elliott for joining us here today. And I'd like to thank my colleague, Minister Fullerton, for her steadfast leadership in the long-term care sector. Over the last number of years, I've worked hard on behalf of the Ottawa Hospital, Hôpital Montfort, CHEO, and the Queensway Carleton Hospital to help strengthen our local healthcare system, to more effectively support alternative levels of care patients across the nation's capital. Today's announcement will help alleviate pressure by adding 254 beds right here at home. This is a welcomed and needed investment by our government for our city as we fight off the COVID second wave and deal with the flu season. The past 8 months have tested us in immeasurable ways, and I want to personally thank our healthcare heroes who continue to fight on the front lines of the pandemic. I can assure you that our government will be there for you. I'll be there for you. We will continue to invest in our healthcare system to ensure you receive the support you deserve so you can provide Ontarians most vulnerable with the care they deserve. Thank you, and I'd like to now call upon my friend and colleague Cameron Love, President and CEO of the Ottawa Hospital, to say a few words.
Well, good afternoon, everyone, and thank you, Minister MacLeod. It's truly a privilege to be here today for this important event during these unprecedented times. The last 6 months has been a challenge for our entire hospital, our community, our healthcare system, and the province at large. But I want to start by thanking the Premier and the members of his government for their continuing unwavering leadership, support, and commitment to invest in our healthcare system across this great province, and in particular for the investments at the Ottawa Hospital and our partners across this region. Because of their commitment, we were able to increase our bed capacity to care for people when they're at their most vulnerable times and when they require access to the Ottawa Hospital's most specialized services. I'd also like to recognize our frontline healthcare staff and physicians who have cared for this community relentlessly since the beginning of the pandemic. They come to the hospital day in and day out, committed to providing our patients with compassionate care that they all deserve. These important investments by our government will provide our healthcare team with infrastructure they need to continue our care to the community during these difficult times. The people in Ottawa and Eastern Ontario can rest assured that with the commitment shown by this government and the dedication of our healthcare teams, we will continue to provide world-class care not only through this pandemic, but in all the times ahead. Thank you for your time today, and I'd like to now hand it over to Mayor Watson.
Well, Well, thank you, Cameron, and good afternoon, everyone. I want to begin today by thanking Premier Ford for inviting me here today and to welcome Minister Phillips and Minister Elliott, and of course Minister MacLeod, MPP Jeremy Roberts, and MPP Goldie Gamari, and our great healthcare workers here in the province of Ontario and in the city of Ottawa. Throughout the pandemic, the Premier has been a great partner. He's always quick to answer my calls and texts. In fact, he usually replies to me faster than my sister does, so thank you, Premier, for that. I also want to take a moment to thank our first responders and the amazing staff here at all of our hospitals. Merci à notre personnel médical et les premiers répondants pour leur service envers nos résidents ici à Ottawa à travers la pandémie et à chaque jour. The provincial announcement of funds for an additional 254 beds at hospitals and alternate care facilities in Ottawa is welcome and much needed in our city, especially, of course, during this pandemic. The extra beds will go a long way in addressing offload delays at hospital emergency rooms, a critical issue for our community. And Premier, I think the first time we met, we talked about this challenge with our paramedics, and you delivered with the budget. We thank you very, very much. These delays, of course, have meant that we have reduced availability of ambulances and paramedics for 911 calls. Last year alone, Ottawa paramedics waited more than 53,000 hours to transfer patients to hospital staff. Cela contribuera grandement à répondre à ces besoins critiques à Ottawa. This is wonderful news for Ottawa, and I'd like to thank Premier Ford and Minister Elliott and our local MPPs and our partners for their action on this serious issue and for their support. Merci beaucoup, and please go out and support a great restaurant here in Ottawa, and thank you for the work that you've done, Premier, to ensure that the small business community has a voice at Queen's Park, and you've responded, and they are very, very appreciative. Merci. Thank you.
Well, thank you so much, Mayor. And before I get started, Goldie and Jeremy, do you have a second? Do you want to come up for a second? Goldie, come on up. Reason I'm bringing our two all-star MPPs, you know, I'm up here every single day, and these folks of our caucus, they're the ones in the trenches. They're the ones behind the scenes, and they're just absolute heroes. I always tell our cabinet, and they agree, our caucus members are more important than anyone out there. So Jeremy, thank you for the great job that you're doing, and Goldie, you're an absolute champion. So thank you. Before we get started, something really disturbing happened today, and it's regarding Whole Foods' policy to ban employees from wearing poppies. I find it absolutely disgusting and disgraceful. It's disrespectful when it comes to honoring our heroes, our veterans. And I'll tell you a story. I was over with Minister MacLeod over at the War Memorial and met two gentlemen, General Lou Mackenzie, which I think a lot of you know, but Michael Tarrant. He's a hero. He was over in Afghanistan fighting for our freedoms. He lost his legs because of an EID. His hands, he had severe damage to his whole body. And then Whole Foods wants to come out and disrespect someone like that, or disrespect people that fought for the freedoms of our country all the way back from 1915 in Flanders Field when they came up with this poppy. I find it disgraceful. And obviously, whoever at Whole Foods made this decision isn't the sharpest knife in the drawer. Matter about as sharp as a butter knife. Our veterans have sacrificed for us, sacrificed for our front line freedoms that we face every single day, that we can walk around, sacrificed for our way of life, sacrificed to ensure our country remains strong and free. When the legislature returns, we will introduce legislation to ban companies from preventing their staff from wearing a poppy during Remembrance Week. I never, ever want to see any company in Ontario ever do this again. The poppy is an endearing symbol of sacrifice and appreciation for all our veterans. And we will always, always respect and stand up for our heroes. And I'll be ready to take questions now.
We'll go to the phone line for questions. First question, please.
Your first question comes from Ashley Legasek with News Talk 1010. Please go ahead.
Hi, Ashley.
Hi, Premier. Thank you for taking my question. Obviously, there's so much going on today.
Is there ever?
I wish I could ask you about all of it, but I'll start out with Peel Region. When your government introduced this new framework, it was kind of showed as a system that would finally give some certainty to businesses for when they could expect to reopen or restrict. But here we are today, and less than 12 hours before they were supposed to be allowed to open up, they're moving to the red zone. So there's no doubt restaurant owners in the region would have spent the early part of this week spending thousands of dollars on food and product preparing for a reopening. For health officials in Peel, it's been pretty clear all week they wouldn't be ready to reopen, so why is this coming so late? And what do you have to say to restaurant owners who are out even more money?
Well, before I pass it over to the Minister of Health, the red zone, they can still have customers come in, a limit of 10 per restaurant, tables of 4. They can stay open till 10 o'clock, stop serving alcohol at 9 o'clock, so it doesn't totally shut them down. But the numbers that we're seeing in Peel and specifically Brampton, they're just going through the roof. It's out of control right now, and we have to react. And these are the tough decisions I absolutely hate making. I hate making them. I told the health table today, I mentioned it to our cabinet. At the end of the day, I have to make these decisions with the consultation of our Chief Medical Officer of Health, the health table, and the public health officer of Peel. I've talked to the mayors as well. Yes, they're reluctant as well to close businesses. But folks, there has to be a point that we do, as uncomfortable as myself and Mayor Watson were to close businesses. It works. The people of Ottawa hunkered down. And look at the difference that we've seen in a few weeks here in Ottawa. And I give all of the mayor all the credit, his leadership. I give all the credit to the people of Ottawa. Folks in Brampton, we gotta hunker down, because it's gonna. What I don't want to do is go to the absolute worst scenario, that everything gets locked down. Our hospitals are at capacity. William Osler is at capacity right now. That's what this is about. So I'll pass it over to the Minister of Health.
Well, we receive specific data on both Tuesdays and Thursdays about what's happening in each region across Ontario. And unfortunately, we've seen the numbers in Peel region escalate quite sharply. So action needed to be taken, as the Premier stated. We've seen the case numbers go up dramatically. The percent positivity rate is at about 11% right now. What we really want to get to is below 2.5%, so it's a huge gap. And we're also seeing the R factor is at about 1.2 and rising as well. So we know that the numbers are out there. There is community spread and transmission. And we also have to take a look at our ability of our health system to manage the increase in cases. Right now, the William Osler Health System has 57 patients with COVID-19. They also have a number of staff. They're away because of illness as well, and they have asked for other hospitals to take any new patients for them, and they've had to cancel some of the surgeries that people have been waiting for a long time. So we know that there's a considerable problem in Peel region right now. We're also going to be sending in help for them, an additional 70 contact tracers, as well as some of the people from some of the northern public health units where the numbers are much smaller. They are also coming in to help with telephone support. So we also want to make sure that we can have people there to monitor, understand what's going on from an enforcement perspective, because we have to get these numbers down.
Follow up?
Thank you.
Thank you both very much for that. Premier and Health Minister, if you could speak to this as well. This is in regards to something Dr. Eileen de Villa, the Chief Medical Officer of Health in Toronto, put out today in a letter for the city's Board of Health to consider. She laid out how severe the overdose crisis in Toronto has been, especially during the pandemic, and she is calling for the decriminalization of simple drug possession. What's your reaction to that, and would you support decriminalization?
Decriminalization of what type of a drug?
Simple possession for a very small amount of drugs, whether it's heroin or cocaine, something like that.
Absolutely not. I am not in favor of legalizing a small quantity of cocaine or heroin. Our government's doing it. We need to put more money, more support into addiction. That's why we're putting $3.8 billion into mental health and addiction to support these people, not to encourage people to do more cocaine, more heroin. You know, we need to have the money to put these people and support them into rehab and support them that way. But absolutely 100% I am not in favor in legalizing small quantities of heroin or cocaine. It's a terrible, terrible drug. We aren't talking about weed or marijuana. We're talking about serious drugs that can kill people, that are highly, highly addictive. So the answer is no. I'll pass it over to the Minister of Health.
Well, first of all, I'm in complete agreement with the Premier on this issue, but we also have a significant plan that we brought forward just before the COVID pandemic struck us, our Roadmap to Wellness. It's a comprehensive mental health and addiction strategy. We are dealing with the addictions issue. We also have a number of consumption and treatment service sites available right now where people can to use whatever drugs they're using under supervision, so that if there are any problems, that there's staff there that are going to be able to help them. That's what we need to do. We need to talk to people, get them into rehabilitation if we can. That's the way these sites have been set up. We want to get people off drugs, not take more.
Next question.
Your next question comes from Taylor Blewett with Ottawa Sun. Please go ahead.
Hi, Kayla.
Thanks for taking my question.
Thank you.
I'm wondering, first of all, why didn't your government announce any new funding specifically for local public health units in yesterday's budget? You know, here in Ottawa, public health is facing multi-million-dollar budget pressures for 2020 and 2021 because of COVID, and we have heard previously that OPH has had to cut back on some of the non-COVID aspects of its mandate. I'm wondering, why not invest more dollars into public health when they have proven such a critical player during this pandemic?
I'll pass this over to the Minister of Finance.
Thank you for the question, Taylor. You know, as part of the investments we've made investments of over $170 million into both directly into the public health system, and of course as well into the community-based health supports, whether it's telehealth and other important areas. I did have a conversation with Mayor Watson this morning, and one of the areas we've also been very active on has been support for municipalities. The Premier led the other premiers to a historic $4 billion of support for municipalities, and of course municipalities share the funding responsibility with public health. So we'll continue to have that dialogue and discussion. I know the Minister of Health has made it clear that public health is an important priority for us. But again, we've provided more dollars, and particularly have said that we will continue to be there with our municipalities to support public health as well as the broader health system.
Follow-up.
And just pivoting a little bit, the budget proposal to grant municipalities the power to issue property tax breaks to small businesses. Just wondering, where did the idea for this actually come from, and are you concerned at all that cities will just have to raise residential property taxes to cover the shortfall this would create?
I don't believe so, and before I hand it back to the Minister of Finance, I call him the architect because he was the architect of a phenomenal budget. We have to create an environment for companies to come here and thrive and grow and prosper. And a good example that the Minister used yesterday on all fronts, not just property taxes, no matter if it's a business education tax, which was unfair right across the province. It was all over the place. Now we have a level playing field that companies are going to be able to save up to 30% on that. But a good example on energy costs was what GM, the CEO, when they left Oshawa a while ago, they said, how can you be competitive in a jurisdiction of Ontario with some of the highest hydro rates in North America? And I got to give a shout out again to Jerry Diaz for putting a great deal together, attracting GM back. But we have to create an environment because we aren't competing against the guy down the street anymore. We're competing against the Michigans, the Ohios, the Pennsylvanias, North Carolinas that want to try to eat our lunch. That's not going to happen. we're going to bring more companies to Ontario because we're going to create that environment until they can go and reinvest into their companies here. They reinvest into the people, reinvest into technology and equipment, and keep the money here. And then you got all the reciprocal jobs too, from let's use auto sector for GM, all the part manufacturers. We signed a great deal with Ford and Chrysler as well. We're going to be the automotive capital of North America. We're just slightly behind Michigan right now, but with GM coming on board, we're going to overtake Michigan and be again the auto capital of North America. And I love the idea of those battery operated cars too. We'll be producing more cars, battery operated cars, than any jurisdiction anywhere in North America, because we have the brightest and the best people anywhere in the world right here in Ontario, and there's nothing we can't make. There's nothing or no one we can't compete against when we're all pulling in the same direction. I'll pass it over to the Minister of Finance.
Thank you, and I do appreciate the question. First of all, I should say this is flexibility for municipalities, so they will choose whether it makes sense. But this idea actually came from municipal leaders. They said, we would like to be able to take our small businesses, who we know are under pressure, we know have been hardest hit in many ways, and we'd like to have a way to be able to give them a lower tax rate than other tax rates in our area. And very specifically, and I did call him out in yesterday's budget, Mayor John Tory of Toronto was one of the mayors who made this suggestion. So we're giving municipalities that flexibility, but we're going one step further. About 40% of the local tax bill for property taxes is actually to the province to pay for education. So we, of course, will keep funding education at record levels, but we're going to match that reduction where municipalities make the choice to make a reduction. And we used an example from the City of Toronto yesterday of a typical bakery where, you know, the municipal reduction, were they to say do a 30% reduction, would be $5,000. You know, the provincial component would be $4,000, so that's $9,000. And then with the education property tax reduction that the Premier mentioned, you know, that would be another $1,100. So we're talking a significant, over $10,000 reduction. And today, when our small businesses are under so much pressure, knowing that that's there next year, starting January 1st, but for all the years after that, that can make the difference between some businesses staying open and or deciding that they can't. So this is support we're happy to provide in partnership. The idea came from our municipal partners. We hope that they will take us up on it, but again, it'll be a choice for each municipality. Thank you.
Next question.
Your next question comes from Brian Lilly with the Toronto Sun. Please go ahead.
Hey, Brian, how you doing?
Hi, Premier. You're saying that you're keeping restaurants closed, or not closed, but to 10, which many restaurant owners would essentially say it means they have to stay closed. They can't operate at that. But you're saying you're doing it because of the case count in Peel and the spread and the positivity. The numbers are actually up now, much higher than they were before you closed. So why are you punishing restaurants, gyms, etc., when if they've been closed for the last 2 months, you know, it was 86 cases on October 5th, now it's almost 300. Why are you punishing businesses that have been closed because of whatever else is happening in the community? Isn't it, as you said to Bill Carroll this morning, that people are just having parties and spreading it that way?
Well, there's a combination of spread right across that region, Brian. And if you look at the positivity rates, they're going through the roof. You look at the William Osler, ever since this has started, I've never had a call from William Osler saying, hey, we're becoming maxed out. And at the end of the day, they just have to hunker down. They have to hunker down and start following the protocols. Follow what Ottawa did. Follow what we did in Toronto before, when all of Ontario was under 100 cases. Brian, it's easy to be the armchair quarterback all the time and ask me these questions, but you know, we have two choices here, Brian. We either just let this just go hog wild, just out of control. We won't have hospital capacity, and people will be dying, and the COVID cases will be running rampant like wildfire across Peel, and then Peel goes into Halton, and Halton goes so on and so forth. Or we do some preventative maintenance, as I say. We jump in there and We aren't asking them to stay in stage 2. We're going into the red zone, control zone, and they're going to be able to at least bring some people into their restaurants and hopefully flip the tables as quickly as possible. But I encourage people to go and support your local restaurants. Order takeout when possible. Buy a bottle of wine, support them. Buy some spirits, buy a case of beer. That's how we can support them. Brian, if you think for a second as a business owner, if you think I like closing businesses, buddy, you're so wrong. It's unbelievable. I absolutely despise closing businesses. But I have to keep the health and safety of this province moving forward. Simple as that.
Follow up?
Okay, Premier, I get that you don't like getting difficult questions from me, but if we can stop with the, calling me an armchair quarterback and then just going to big scary numbers. I'm asking you about the fact in front of us. Whether we're talking daily count cases or 7-day numbers, after 28 days of restaurants and gyms being closed in Peel, the numbers are up dramatically. So the spread is obviously not happening there. How does keeping them closed or restricted to such small numbers that many say they can't operate, how does that help? I'm asking you a specific question based on your data. I'm not being an armchair quarterback. I'm not trying to be a jerk to you. I'm trying to do my job, sir, and ask a question.
I appreciate that, Brian.
How does this help if the spread happened when they were closed?
Well, I appreciate that, Brian. And I always say I'm not one to stand up here and pretend I'm a medical professional. I listen to the advice of the Chief Medical Officer, our health table, our Minister of Health, and when they're showing me the numbers and they're giving me the recommendations, I have two choices, Brian. I either ignore them, and I used this example last time with you. You go to the doc, and the doc says you got an issue. Do you ignore him or do you take his advice? Well, sometimes you go get another set of ears and eyes and get advice off another doc. We have well over 100 docs giving us all this information. It's not just Dr. Williams. We have the local medical officer, Dr. Lowe, asking me to do the same thing. So either I just wash my hands of it, Brian, and say we just aren't going to listen to the docs anymore, and let's just go at it. I don't believe in that. I believe in protecting the health and safety of the people of Ontario. And I'll pass it over to my Minister of Health.
Well, as the Premier has indicated, we take advice and recommendations from Dr. Williams, from the Public Health Measures Table. There are a number of other doctors that feed into that table that provide us with advice. But the reality is that there is community spread due to a wide variety of factors, including restaurants, bars, workplaces are also a concern. And then people just not following the basic public health rules of making sure that you maintain social distancing, washing hands frequently, wearing a face covering where it's necessary to do so or where you can't keep that distance, and staying home when you're ill. So this is really important for all 14.5 million people in the province of Ontario, and especially right now for all of the people in Peel Region. We want them to move out of this area that they're in right now. We want to see those numbers go down, and with everyone following all of the rules, it will happen. But we have to take some action right now because our hospital system is becoming overwhelmed. We want to be able to treat everyone that comes in with COVID-19 or whatever else brings them to hospital. So we have to take these measures. It's not something any of us want to do, but we also have a responsibility to protect the health and safety of the people of Ontario, and that's what we need to do now.
Last question.
Your final question comes from Colin DeMello with CTV News. Please go ahead.
Hi
there, Premier Ford. I just want to be clear here. Your government says that you guys are loosening or putting Peel in a red zone, and therefore there are restrictions. But you guys are actually loosening the restrictions from the modified stage 2 to the red zone. You referenced Dr. Lowe. Dr. Lowe had specifically asked your government or Dr. Williams to keep Peel Region in a modified stage 2 for at least another week. Why did your government not listen to what Dr. Lowe specifically requested?
So I'll tell you where Peel was going. Peel was going into the restrict, the orange level. After we ended up getting this notice from Dr. Lowe, he communicated with our chief medical officer. And I guess we came up with and this has been going on all night, all day today. And it's not just Dr. Lowe. I have to listen to the mayors too. Mayor Thompson, which we were kind of playing telephone tag back and forth today, we never connected. Talked to Mayor Brown. I talked to Mayor Crombie. And, you know, they were hesitant to close down restaurants. And then we have Dr. Lowe asking to stay in stage 2. And then I have to consult with our chief medical officer. Colin, I'm telling you, it's not an easy decision. So there's a happy compromise, but we also have to protect the integrity of the framework. They've fallen, and everyone can see it. It's fully transparent. They have fallen into the and the control area. I apologize, the red zone, the control area. And once they fall into that, then they're in that zone until we get out. So I think it was a relatively fair compromise, again, trying to keep businesses going to a certain degree, keeping schools open, cooperating and collaborating with the mayors, working with the local public health officer, and working with the chief medical officer of Ontario. So you have everyone giving you advice, and I think it was a fair compromise. We're talking about a week. And again, Colin, I don't want to close these folks down, which we aren't closing them totally down, but I understand their concern too. But I go back again, Colin, you see the news as much as I do, and everyone at home. You see what's happening in the UK. There's lockdowns in France, UK, Ireland, Spain. It's running rampant. And I don't want to get into that position that we have to lock down the province again. It'd be terrible, absolutely terrible.
Follow up?
Thank you, Premier. So I wanted to ask about the framework that you're talking about, this color-coded chart that a lot of people are now getting used to. We've spoken to multiple health experts who are saying that this is actually confusing, and that the thresholds that your government has set are way too high. In fact, we would have to get into what one official called Trump territory, how it's spreading in the United States, in order for us to really start to address the issue. I'm trying to understand here, how did you get to this criteria of 10% positivity rate, hospitals being on the verge of being overwhelmed, multiple outbreaks? How did you get to that specific criteria, and isn't that the inferno that you had been talking about earlier this week instead of the smoke?
Well, again, this is structured around preventative, as I say, preventative maintenance, being proactive before there is an inferno, as I used the example the other day. And we've rolled that out since Tuesday. We're going to keep moving forward, but it's being proactive too. When we see issues, to jump in there, to put more contact tracers in there, to have more pop-up centers in the hot areas. And that's what we're going to focus on. I'll pass the balance over to the Minister of Health. Thank you.
Well, we need to continue to be consistent with the decisions that we're making. We've set up the framework. It was designed after full consultation and advice from Dr. David Williams, the Public Health Measures Table, the many members at the modeling table as well. And there's other people who have volunteered to come forward. So this isn't just the advice of one person. Not every public health doctor is going to agree with this, but these are solid recommendations that have been brought forward by a number of public health experts. And that's what established the framework for us, and that's what we're working with now, so that there can be some certainty to the people of Ontario about where their public health region sits, and then be able to make their own decisions about what they want to do within their own region, whether they want to go out to dinner, whether they want to go to a gym or not. I think the personal responsibility aspect of it is also very important. So the framework is there for a number of reasons, but it was fully developed in consultation with public health experts.
Thank you, everyone.
Thank you, everyone.
Thank you.